Hello, my name is Alyssa White. So with the pandemic, I'm feeling more and more okay as the pandemic progresses, and hopefully passes soon. The pandemic has scared me in a few ways because my family, which includes my mom, my dad, and my little sister, believe that they got COVID in February before the pandemic was like the biggest talk of the year. And then later down the road, in about late June, early July, is when my grandpa contracted COVID from his job, and he was put in the hospital. He works at the Luxor, and fortunately, he survived. He was almost put onto the ventilators, but he was able to fight before he had to go onto that. He told us that his family kept him going, and it made him fight harder. So it was really amazing that he was able to like walk out of that. He had to go back to his house where my nana is, and because he had to go and quarantine for 2 weeks because the hospital started getting overcrowded due to more and more patients coming in. And so, due to him going back to his home where my nana is, he gave her COVID as well. My nana really wasn't affected by it. She had a sore throat, maybe a stuffy nose, which is really amazing because she has asthma. And so they both recovered from it, and um, I was really surprised that my nana didn't really get affected by it. Some interesting things that I've learned about the pandemic or about the public health crisis is that the arena of health communication is very intricate due to the high media environment and the redistribution of control over content about the pandemic. There are similarities from this week's module with the outbreak. So, in the article that's titled Disentangling Rhetorical Sub-Arenas of Public Health Crisis Communication by Rodden, Garcetti, and Odin, is that it states that there's that redistribution of content about COVID that I previously stated. And this reminds me of how the pandemic was happening in like December and early January, but there wasn't much news coverage about it in December and January. I feel like my local community has handled the crisis communication a bit poorly because of the politics that were taking place at the same time as the pandemic, and many people were not following that mask mandate. And when Governor Sisolak gave out the rule on big gatherings and how it shouldn't be over 10, or like be cautious of about five or more people, many people didn't listen to that. And that caused the pandemic to spike in Las Vegas, and we were one of the highest cities to have the COVID outbreak. Um, I think that UNLV is handling it quite well by having like their students do online class rather than risking it by going to the university. I would have had an online or I would have had an in-person class, but due to the pandemic, they changed it onto online, and I think it was a lot more beneficial to do it online to keep everybody safe as well. Federally, I think the communication can be improved so that the different like jurisdictions or like smaller cities and counties can gain a bigger security on the pandemic so it doesn't spread farther. I'm receiving most of my information through social media, such as like Instagram, Snapchat, Facebook, Twitter, and my family as well. My aunt is an ER nurse, and I get information from her all the time. And there's been differing opinions between family and friends that I have been in contact with, and I have just chosen to keep my distance from them due to them having the complete opposite views, and they're kind of like fighting it as well. Um, I've taken part in some of the social media trends, such as spreading information about the pandemic and mask mandates, all on my social media. Um, I also shared like those mask mandate posts at an early stage of the pandemic as well, just to keep everything safe and put everybody in their best interest. Thank you.